So, thanks. Now, I'm going to take you to some of the work we're doing. This is ongoing work in two conflict-affected settings, Somalia and South Sudan. This is a project that was an intervention we're evaluating that was developed by UNICEF headquarters in partnership with the in-country UNICEF teams and is being implemented by local partners, global and local partners. So Johns Hopkins, we're doing the evaluation, and my colleague Nancy Perrin is here, who's also, we've been working a lot on developing a measure and how do you operationalize this in the field. So I'm going to talk a little bit about the field work we're doing. So this intervention developed by UNICEF headquarters is titled Communities Care. And it's a partnership to develop and implement and evaluate a gender-based violence prevention and response intervention in humanitarian context. So it's being tested in these two settings with the hope that we can scale up and implement in diverse humanitarian contexts. And it's focused on strengthening the positive social norms that protect women and girls from violence and leveraging the societal dynamics to change the social norms that serve to hide or actually reinforce gender-based violence. It's also focused on the social norm perspective, where we're promoting the establishment of self-sustaining social rules that are upheld by these rewards and punishments that we are seeing, have been talking about earlier today. And we're also placing an emphasis, and I think this is really important, as Lori said, we can do all this primary prevention work and changing norms, but if we don't have good structures or response programs in the communities, it's really for naught. And so we are looking as well at strengthening the multi-sectors that are focused in these humanitarian contexts and in many communities. But the health system, the psychosocial support, education, security, justice system, we're also linking with peace building, which I think is a very important component. And then the goal is these positive messaging, which we've heard, as Rebecca talked about, the work that they're doing on discussion groups and deliberations, these positive messages through actions that the groups, the community decide on, are used to reinforce the positive outcomes and social norm change. So our strategic approach is an intervention toolkit that was developed to use across humanitarian settings, and it's with the guide to help focus on primary prevention efforts that target the social norms related to the diverse forms of gender-based violence. We do have a specific focus as well on sexual violence in this project, both within the home, within relationships, and then community, given that this is a conflict-impacted community. And then a comprehensive community-based multi-sectoral response to gender-based violence. So building those systems and engaging healthcare providers in social norms change by engaging them in the training and the programs that we're doing. And then also focusing on strengthening the policies and practices in the humanitarian context. So we have to bring in all the sectors in these contexts as part of this movement. So the overall program strategy is again, the multi-sector, but it's two components: strengthening the formal and informal response systems and services, and through addressing the social norms reflected by the service providers and the institutions, and then engaging community in action for prevention using this social norm perspective. So the key activities, if we break down looking at the strengthening of the formal and informal system, is we have to do some ongoing mapping of the multi-sector services to address where these gaps are and the bottlenecks with services. Where are people accessing services? Are they using the community health workers to talk about violence? Are they accessing the healthcare system to disclose violence? And what we find in many of our sectors, in many of our areas, that they're not. That's probably the last place in many areas they're going. And then we're doing process and impact evaluations with ongoing monitoring and evaluation with our teams. As Lori talked about, just with the analysis, we can look at these outcomes as we're doing a longitudinal impact evaluation, but we also need to know what the mechanisms and the processes and these changes that we're seeing. And then critically important is the capacity development. The providers have to go through this social norm training as well, but also making sure that referrals are in place. We're giving referrals that these systems are in place. Reinforce the survivor-centered care. improve safety and security associated with reporting and disclosure, promote understanding of the benefits of care, and build the community's trust in the service providers. We know that that is key as well. There's a lot of challenges with trust about confidentiality with service providers, as well as how competent they are to provide care. So, and then when we talk about the community engagement and using the social norms perspective, we're looking at mapping of opinion leaders and networks and ways to transmit messages. And then we have the intervention focuses on community discussions, deliberations group with diverse stakeholders. And so that is the 15-week. It's a 15-week program where these groups come together and facilitated by a trained community member, and they have specific topics each week that they discuss that bring up the issues of the normative and the empirical norms, and bring up the discussions about how they're being addressed in the community. And then the identification and capacity development, mentoring these community discussion leaders to ensure that they can support the communities in addressing issues that reinforce gender-based violence, and also identifying positive community actions that prevent gender-based violence, and identifying and supporting individual and collective actions in favor of GBV prevention. So it's helping the communities come together, the groups, come together at the end of this 15 weeks as they define the actions that they're going to take. And then we often have community discussion members be trained to be facilitators to continue the project. So we finished one round of the 15-week training. We're off now doing another round in each of these settings, and I'll talk more about the design. So the first part was really, when we came to this, is how do you measure social norms in the setting? And so we did, of course, the formative work in both settings, and many of the issues that we've talked about in the quotes are exactly what you hear in Somalia and Mogadishu, as you do in Yei and Warp in South Sudan. And then as my colleague Nancy Perrin is a psychometrician, we had to do some psychometric testing of our outcome measure. Is this a reliable and valid tool? And then as we did that testing in both settings. We did refinement of the measures to have a tool that we could hopefully share at the end of this study with other folks doing this work. So if you're doing this work, you want a brief tool, you want a brief, reliable, and valid tool. So our measure right now is 18 items, but it's asking questions in 4 domains, okay, or subscales which we descriptively name. This came from the factor analysis. So we've named these. There might be other names for the subscales that are better, but these are the 4 subscales or areas we're measuring with this tool. And so the final measure includes these 18 items, and each item asked from 3 perspectives. As Christina talked about, the influential other, the reference group. What do you think people who are important to you expect you to do? And then the personal beliefs related to that norm. And then what is happening in their community related to that norm. So we're asking each of these 18 items from those 3 perspectives. And let me just give you an example of subscale. So this is the family honor subscale, which is 6 items, I believe. And so we would ask, what do you think people are important to you expect you to do? And so the question would be, expect women and girls to only report sexual violence if they have serious physical injuries. Expect a husband or father to retaliate against alleged perpetrators. Expect that a woman's and girl's reputation will be damaged if she reports sexual violence to authorities or elders. Expect women and girls to not report rape to protect the family dignity. Expect sexual violence to be handled within the family and not reported to authorities, or fear stigma that if they were to report sexual violence. And these responses are on a Likert scale from 1 to 5, with strongly agree to strongly disagree, with the higher scores indicating that participants think more the people who are important to them or influential to them would endorse protecting family honor. So we've gone through phase 2, phase 3. We are in phase 1, phase 2. We're in phase 3, and our primary outcome is changing social norms towards sexual violence. And so this is a randomized controlled trial with 2 intervention and 2 delayed control communities in each country. We are in Mogadishu, which is certainly an urban area, in 4 parts of the city, and then we are in 2 separate provinces in South Sudan. And it's a longitudinal design. We've completed midline in Somalia, and we're a little bit behind in South Sudan because, a war broke out, civil war broke out, and so it does slow things down, and that's some of the challenges in these environments. But when you have amazing local partners who are really deeply care about this work, they're out there doing it. So we were interviewing 800 adult women and men from randomly selected households and intervention and delayed control communities in both countries. We are also doing interviews with the intervention group participants, so those folks that are in that discussion, deliberation, and I'll give you just an example of some of the findings we have from Somalia. Again, we're doing interviews with the multi-sector providers that have the training, that are interacting with community. And then we're also looking at satisfaction of care. Certainly as a healthcare provider, we're interested in women who access healthcare services, specific questions with women who seek health services. Are services more trauma-informed? It's because that's what we're really working towards. So let me just give you 3 slides. So as Christina said, we focus on, in this vignettes are examples, and these come from our focus groups, stories that we hear all over the world, so none of this will surprise you. But here's the script that we would use in the 15-week discussion groups at baseline. Before discussion groups start, we have this script. A young woman is raped when she is alone after school. She knows the man who raped her. He is a friend of her father. He stopped by the house looking for her father, but when he realized she was alone, he attacked her. So then here we have 3 statements. From agree, not sure, to disagree. So we have before this discussion group, 2 months into the group, and then by the end of the discussion group. So as you see, the girl should not report the rape to her family. 46% agree. The girl should, before the discussion group, the girl should not report the rape to authorities. 12% agree, where the majority disagree with that. The girl probably did something that encouraged the man to have sex with her. A quarter of the people agreed with that. Now as we look, we're seeing what we hope to see, a shift in those agreement with those statements to a disagree, and from not sure to disagree. And so by the end of the discussion group, we have over 90% saying that they disagree with these statements. Now, granted, this is a monitoring of the discussion groups, and so we don't have long-term, but we are looking at further out the longitudinal of the community change. Here's the second one. Your sister-in-law comes to talk with you about troubles with her husband, your younger brother. She says that her husband is coming home late at night, and that he gets home, he is often angry and aggressive, demanding to have sexual relations. If she refuses his demands, he beats her. She also tells you that the children see the violence. So again, there are the 3 statements. The man is showing his love for his wife. 27% before the discussion group agree with that. The man has the right to demand sex from his wife. Over 80% agree. And it's most important for the women to take care of the husband and home. 75%. So these are consistent with the norms that we've talked about this morning, and how we are trying to shift these norms. And then, as you see, we're moving at 4 months to 90% saying that they disagree that the man is showing his love for his wife. And then moving to 80% that the man has the right to demand sex from his wife. And then over 75% that it's most important for the woman to take care of her husband and home. And then the last is a 14-year-old is raped by a group of older boys on her way to school. She heard the boys telling each other that they were real men now. She feels humiliated and believes that she has dishonored her family. She will not tell her parents because of the shame. She believes that if anyone finds out what happened to her, no man will love her and her future will be destroyed. So again, here the boys can't, the statement is the boys can't be blamed for behaving like this. Boys do these things when they are together. So 15% agreed, but the vast majority disagreed with that. The girl should not tell anyone to protect her honor. Again, 20% agreed, but over 70% disagreed. The girl should tell her parents and marry one of the boys, right? And so, I'm sorry, I can't see on my screen. 65% agreed with that. And then we're seeing that shift again, which we want to see And so this is just an example of from some humanitarian contexts that bring on different challenges than other contexts that we've been talking about. This is a community where we're also working with internally placed persons. There's a very different, family structures have changed dramatically. Women are now working outside the whole home. There's a lot more community gender-based violence programming and awareness programs and services, so that plays into it. And we have amazing partners, and you have to have amazing partners that are dedicated to this work. And also have safety and security as a challenge for community members who want to participate in our programs. In Mogadishu, certainly al-Shabaab, they could be targeted when groups come together, so we have to really think about how to do this and work with IDTP camp leaders, for example. So thank you very much.